Hi, I'm Dr. Stowell. I'm a former director and faculty member here in the ADN program. My current responsibility is to work with the faculty to present you with some new resources to help you as you progress through the program. The first two videos or resources will be videos, 2 videotaped lessons, one on critical thinking, special critical thinking skills for test taking, and one on critical thinking skills for studying nursing material. Then the third resource I will be presenting will be conducting focused test interviews. These test reviews have also been named reflective test reviews. Well, no matter what they are called, all tests and reviews are designed to develop your critical thinking skills and give you an opportunity to demonstrate your ability to think and to act like a nurse. Nurses use critical thinking skills. Sometimes these critical thinking skills are also called clinical reasoning skills, and nurses use clinical reasoning skills every day. Now, you are not new to a nursing course. As a matter of fact, you're actually halfway through your first, second, third, or even fourth semester right now. So even test taking isn't new to you. But stay tuned. I'm going to tell you some things you probably didn't know about nursing tests. What? You already know these things? Not to worry. This video is a good way to refresh your memory before your next test. So let's take a closer look at NCLEX type questions. All your nursing school exams are modeled after the NCLEX RN test. Excuse me. The NCLEX RN is the great big exam you take to obtain your license as an RN, a registered nurse. It is computer adapted, which means when you answer a question, if it was an easy question or you got it right, it'll give you the next question a little bit harder. And if you got that one right, it will make the next question even harder. But if you didn't get that hard question, next question you'll get after that difficult one will be an easier one. And so you will be flipped back and forth throughout the test, depending on your knowledge pertaining to that particular question. Another aspect of the NCLEX RN is that it is a timed test. You don't have all day to do this. You have a couple hours, but you don't have all day. Another aspect is it has multiple choice questions and something called alternative format questions. And we'll talk about that a little bit later. Another factor about the NCLEX is that there are all kinds of review books out there that are loaded with practice questions. They are widely available for your use, and I highly recommend that you get some. Then another aspect of the NCLEX RN is that using the critical thinking skills for test taking and active learning techniques, which we will be talking about on another video, will actually help you to pass the NCLEX RN. It has been my experience that because these NCLEX questions are so complex, they do require some special skills to answer them correctly. That is why I'm going to be focusing on these special critical thinking skills that you're going to use for test taking. And then we are going to examine some NCLEX type questions and focus on some techniques to help you answer them correctly. Excuse me, I am getting over some laryngitis. I apologize if I sound kind of scratchy. Okay, we're going to now look at the NCLEX questions. Let's look at the anatomy of an NCLEX question. Did you know that nursing test questions are designed to be hard? Yes, they're designed to be hard. They are designed to be complex. They have layers of complexity built into them. Another aspect of an NCLEX test question is that it will present you with common situations nurses encounter in their practice. And it will test your critical thinking skills to show that you know how to handle these situations. The NCLEX test questions are designed to prepare you to take the NCLEX RN test. Now, what I meant by nursing test questions are designed to prepare you to take the NCLEX questions. I'm talking about the ones your teachers design, the one you have in your courses, and the ones that you get for your practice tests in ATI and in any kind of a practice book that you might purchase on your own. So we're talking now about the anatomy of a test question. So let's look a little closer at how the test questions are written. Well, there are multiple choice questions. Let's look at the multiple choice. I did say that there are alternative formats, but we'll get to that later. So let's look at the multiple choice questions. Chances are you have a lot of these in your own teacher-made tests that you take in your courses. Okay, the first part of a test question is the STEM. And I don't know if you can see my pointer here. I don't know if that's going to show up. But anyway, the STEM. And the STEM is the problem. The STEM gives you a problem and states it very clearly and very concisely. It presents all that you need to know about the situation. Everything you need to know to answer that question is right there in that sentence or in that question area in the STEM. Next, you have the options. Now, most people call the options answers, but no, that's not true. 3 of the options are distractors. And these distractors are related to some part of the situation in the problem, but they make you think very critically to determine which one is correct. And then there is only one correct answer. So there's going to be, of these, there's going to be 3 that are distractors and only one that's going to be the correct answer. Now, before we try to answer that question, I want you to see the layers of difficulty that's built into this particular question. This question is designed at the comprehensive level. An easier kind of question would be formulated at the knowledge level. So my first example here is not a knowledge level question. It is a comprehensive level question. It's harder than a knowledge question. Why? Because you have to understand the information. So I'm going to read the STEM. A nurse is assessing placement of a nasogastric tube. Where should the distal end be within the body? Okay. What information is in there that you need to know about? What is this question talking about? If you chose or thought nasogastric tube, correct. And what is the nurse doing? The nurse is inserting it into the body. Now, the options. Even if you think you know the answer to that question, read each one of the options before you make a choice. And when you read the options, ask yourself, is this the answer? Why or why not? So let's go through this together now. Okay, the question is, where should the distal end of the nasogastric tube be within the body when the nurse is assessing the placement of it? Where is it located? Would it be in the trachea? Should it be in the trachea? No. Why not? Because the trachea is part of the respiratory system, and we are going to deal with the gastric system. Okay. Should it be in the bronchi? No, because the bronchi are also part of the respiratory system. Maybe it should be in the stomach. Stomach. Yeah, that sounds good, because the stomach is part of the gastric system. And we are checking on the placement of a nasogastric tube. So the tube is going to be the end, the distal end, which means the far end, is going to be in the stomach. Oh, I think that's right. I think that's right. I think I'll check that off. I think I'll click the button on that. Wait a minute. There's one more choice. The duodenum. Maybe. I know. Sometimes the nasogastric tube goes into the duodenum, but would that be right? Let me do a little more critical thinking. Let me remember my anatomy. Where is the duodenum? Oh, the duodenum is in this small intestine. That is the first part of the intestinal tract. Oh, that's right. If it's actually located in the duodenum, it's gone too far, and the placement is not correct. So, I will choose stomach. Now, do you see how I thought my way through? Do you hear how I analyzed each question, how I did some critical thinking for each question? And did you hear how I asked, would this be the answer? Why or why not? So I gave a rationale for each one of those choices. And by the way, the correct answer is stomach. So good for you if you got that. Now, the next question is a knowledge question. Actually, I think I should have rearranged my slides, but to have knowledge questions first, but nevertheless, we were talking about complexity. So let's back up a little bit and look at knowledge questions. What would a knowledge question look like? They are actually the easiest to answer because they just ask you to remember or recall information. Remember, the comprehensive question, the comprehension question asked you to understand, to comprehend what's going on, what the nurse is trying to find out. Okay, back to this knowledge question. Which is within the expected range of a radial pulse for an adult? Okay, that was the stem, and they're just asking me, what's the expected range of the radial pulse of an adult? Could it be 50 to 65 beats per minute? Possibly. 70 to 85 beats per minute? 90 to 105 beats per minute, 110 to 120 beats per minute. One of these, let's see, 70 to 85. I remember 70. I'm not so sure about 50 to 65. Maybe for a runner, that seems a little low to me. Maybe, and this is a range, we're looking at a range, 70 to 85. Well, 72 is pretty common. 85 might be a little high. I'm not really sure about that. 90, let's see, where's my cursor? 90 to 105, oh, that sounds high. And 110 to 120 beats per minute, that's probably tachycardia. Yeah, I don't think so. And so I am going to choose 70 to 85 beats per minute. And that would be in the textbook somewhere. And I do not have a copy of your textbook. So I do not know what the textbook says. But my critical thinking would lead me to believe that the answer is 70 to 85. Because 50 is low. 50 is low. Adults don't usually have a low heart rate like that, if they are, unless they're athletes. Same way with this 50 to 65. That's low. 70 to 85 is, as I said, seems reasonable. A little bit high on the 85 side, but reasonable. 90 to 105, that's fast, and 110 to 120, that's tachycardia. So I'm going to choose 70 to 85. Now, we have another comprehension question. Let's see what's happening here. To talk a little bit more about characteristics of a comprehension question. To answer a question at this level, you will need to know a fact, you will need to know knowledge, you will need to know how to interpret facts, and you have to figure out what are the implications of the facts. Okay, so let's read, I'm going to read this down. Nurses use the interviewing technique of clarification when interviewing a client. Which is the nurse doing when this communication technique is used? Okay, so let's clarify what in the world that STEM is asking. Okay, what's the communication technique? Oh, clarification. When is it being done? During an interview. So during an interview, the nurse is using clarification. And so what does clarification mean? What's the question asking? It's really asking what's clarifying? What's the clarifying technique? So here are my choices, my options. Does clarification mean I am paraphrasing the client's message? Paraphrasing means I'm just saying back, reflecting back what the client is has said to me. Restating what the client has said is saying exactly what the client has said, but paraphrasing is kind of saying it in my own words. Got to be sure that I understand the difference there. Is clarification verifying what the client is implying? That sounds reasonable. Is clarification reviewing the client's communication? I think I better look these over again. And I'm demonstrating to you, I'm modeling to you thought processes that are helpful when you are taking a test. Okay. Okay, so I'm trying to remember what the definition is. Definition is of the technique of clarification. Paraphrasing, well, that's just saying what the client's has told me. Restating also is just saying what the client's told me. But if I'm verifying what the client is implying, I am clarifying that I understand what the client is telling me. And that sounds like it might fit. Would clarification mean reviewing the client's communication? I don't even know what reviewing the client's communication means, so I'm going to eliminate that one. But I think that verifying is also another word for, verifying is to make clear what the client has said. Be sure that I understand what the client has said. So you see how I am showing you some thought processes here. Now, here's an application question. We're going to be talking about them. Application questions have another layer of complexity. You need to know several things to answer them. So let's look at this question. I'll read the stem. An older client's skin looks dry, thin, and fragile. Which should the nurse do when providing back care to the client? My options are applying a moisturizing body lotion, massaging using short kneading strokes, using soap when washing the client's back, leave excess lubricant on the client's skin, to answer this question, this is what I need to know down here. I need to know what are the common developmental changes in the elderly. That would be thin, dry, fragile skin. Then I have to look at the interventions, and I would have to know what effect would each of the interventions have. And then how is the answer, my choice, related to the client's assessment data? Okay, so we've just said that the common developmental changes in the elderly are dry, thin, and fragile skin. So let's now look at the interventions. What effect would this intervention have? If I apply a moisturizing body lotion, that would hydrate the skin. If I massage the client's back with short kneading strokes, no, I don't think so, because if the skin's real thin, I might be breaking the skin if I massage. What about using soap when washing the client's back? I think the effect would be drying. Yes, soap is drying, but her skin is already dry. No, I'm not. I'm going to eliminate that one. What about leaving excess lubricant on the client's skin? how would that be related to what the client's condition is, and what effect would that excess lubrication have on the client's skin? Well, I think it would be messy, because it's a lubricant, not a moisturizer. A lubricant is something that will make things soft. Lubricating and smooth makes it smooth, but mostly smooth. So anyway, therefore, I'm going to choose applying a moisturizing body lotion because the skin is dry and fragile and thin, and it will hydrate the skin. So number one is the answer there. Now, at this point, the hardest kind of question is an analysis kind of question. And with an analysis question, you have to interpret a variety of data and recognize differences and commonalities in the data. So I'll read the question. A client had a brain attack. Some people call it a stroke. Some books call it a cerebral vascular accident, whatever. Anyway, this brain attack resulted in paralysis of the right side. When clustering data, the nurse grouped the following data together: drooling of saliva and slurred speech. Which information is most significant to include with this clustered data? So what is the question dealing with? The situation is the nurse has assessed the client, and all of the choices are possible findings for somebody who has had a stroke. Okay, she found all these things, or he found all those things. So, but the nurse has started to group the data together, and what she has grouped so far is the drooling of saliva and the presence of slurred speech. So, which of these following options would she want to add to that cluster of data? Okay. First option is receptive aphasia. Well, people with strokes often do have receptive aphasia. But how does that relate to drooling and slurred speech? I don't think it relates, because receptive aphasia pertains to how they understand words, the ability to understand what people are saying to them is lost or decreased with a receptive aphasia. Okay, the inability to ambulate. Well, if they've had a stroke and they're paralyzed on the right side, that certainly would make ambulation difficult. But I don't see the connection between drooling and slurred speech. Difficulty swallowing. Drooling of the saliva and slurred speech. They're drooling. Maybe they can't swallow very well. It could be difficult. And it would be difficult because the stroke resulted in paralysis of the right side. And that doesn't just mean the right arm and the right leg. It even includes the right side of the face, the mouth too, and the tongue. So difficulty swallowing, I believe, is going to be the choice. But wait, there's still another choice. Incontinence of bowel movements. Well, it is true that people who have had strokes are often incontinent of bowel movements. But what does that have with drooling and slurring their speech? And nothing. So I am going to say that number 3 is the answer, and it is. And I came to these conclusions because I interpreted a variety of data. Here's the data. I interpreted that. There's data up here. What the client had, a stroke. What were the results of it? Paralysis of the right side. Another result was drooling of saliva and slurred speech. And of all these possible pieces of data, which we actually don't know if the client had all these things, but it is quite likely that they had all these things, all these problems, because they are typical with a stroke. But what really pertains to this particular data set is the presence of drooling saliva and slurred speech, and the fact that the patient had a stroke and paralysis of the right side. Now, what I have noticed personally as a teacher for many years is that when a student has a test question with all of these things in and more than one sentence, look at this, it has 1, 2, 3 sentences. Somehow they get brain freeze or something. I don't know what happens, but they usually don't read the whole thing. They usually don't see what's in there. And so if you have that problem, or if you want to prevent having that problem, what you need to do is read every word of every sentence. And this is true for all of the test questions. For all of the stems, you need to read every word in every sentence. But students get kind of bogged down when it comes to a long stem. So, memo to self. Read every word in every sentence in the stem, especially with stems that have more than one sentence. And as you're reading, identify the key pieces of data. And I have just gone through them. Client had a brain attack or a stroke, paralysis of the right side. Nurse is grouping the data, and that she grouped drooling of saliva and slurred speech. And now our question is, which information is most significant to add to that data in that cluster, in that particular cluster? And it pertains to swallowing, and it would be number 3. Now, excuse me, let me get a drink here. Sorry. Okay, and now those items that I just showed you helped you to see how a question is made difficult, and it is supposed to be difficult because nursing is difficult. Okay, but now there are questions based on the nursing process, and the nursing process pertains to assessing, analyzing, implementing, and evaluating. So let's look at this one. I'll read the stem. A nurse assesses that a post-op client has a decreased blood pressure and weak, thready pulse, and concludes that the client may be hemorrhaging. For which additional signs of hemorrhaging should the nurse assess the client? Oh, sorry. Sorry for that typo. Okay, let's start out by identifying the key words and what and how we would and how they are clustered. Key word is post-op. Okay, what happens in an operation? They've been cut. Yes, the incision has been sutured, but nevertheless, there is a break in the integrity of the skin. And also in the blood vessels under the skin and around the organs. And maybe some of the organs have been have an incision in them because of that was part of the operation, whatever it was they want to take out or examine or whatever. Okay, so now we have a post-op client. And the client has decreased blood pressure, a weak and thready pulse. The nurse puts those things together and believes that the client may be hemorrhaging. But if the client's hemorrhaging, are they the only signs that a hemorrhaging person would show? The question is asking for additional signs of hemorrhaging. So what other signs should the nurse be looking for to go along with his or her conclusion that this client is hemorrhaging? Okay, now let's look at the options. Pain. What's the relation of pain to hemorrhaging? Nothing. It may accompany hemorrhaging, but it's not a sign of hemorrhaging. Jaundice. What is jaundice? Jaundice is a yellow coloring of the skin coming from liver damage. What about tachycardia? What does tachycardia mean? It means a pulse above 120. And actually, I don't know the current ranges that your textbook says, but it would be high. It would be tachycardia. There is a certain range of beats per minute that's considered tachycardia, and it just means a very high, abnormally high pulse. Now, your textbook will tell you what those ranges are for tachycardia, but at least the nurse would be thinking, well, I should look for tachycardia. Now, why would the nurse look for tachycardia if he or she suspects hemorrhage? And here's where you have to have the knowledge of what tachycardia is and what it does Okay, it's a fast pulse. Now, if the patient's hemorrhaging, what is the relationship between hemorrhaging and tachycardia? Hemorrhaging means the patient's losing blood, and if the body doesn't have enough blood, the cardiac system will try to compensate by pushing whatever remaining blood is there around much faster, so that there is a good exchange of oxygen and removal, a good exchange of gases to support the systems in the body. Well, that's the relationship. What about that sounds good. I like that. I can see a correlation there. Hyperthermia, because there's one more choice. I don't want to be too quick, and not consider hyperthermia. So, what does hyperthermia mean? Hyperthermia means overheated, high body temperature. Well, remember that if a person is losing blood and they are losing hemoglobin, the body will be cold, not hot. The a person can get hypothermic, but I don't see any relationship between hyperthermia and hemorrhaging. So based on my way that I thought these things through, tachycardia will be my choice. And tachycardia is the right answer. Now, we've been talking, and I've been demonstrating, talking about the need to analyze the test question. What is the question asking? What's it covering? What are the options? And how do they relate? How do they relate to the question? Well, let's look at strategies to help us analyze the STEM. When we're taking a test, we do not want to make assumptions about the information that's in the STEM. That's all the information is you have. If that's the situation you're dealing with, that's the only situation. That's the only set of facts that you have. So leave it be. It is what it is. Now, do not add information from your own personal experience or your own mind. Some people say, well, I'm going to interpret that question because my uncle had hemorrhage and he had such and such. No, you cannot do that. That would be an aspect of reading into the question something that's not there. Now, do not read into the question anything that is not there. If it's not there, it's not there. But what students sometimes get tripped up on is they remember from the clinical situation that they had a client who fit some of the characteristics of the one in the test question. And so suddenly everything about the client that they had in clinical pops into their mind, and they confuse that with what's really written there. So don't read anything into the question. Another way that students get mixed up with this one is they'll say, but it doesn't say anything about such and such. Well, the question wasn't pertaining to such and such. So do not read anything into the question that's not there. And then in the STEM, you're going to look for indicating words. You're going to look for words that will give you clues like first, initial, most, priority, never, except. So this will guide you into understanding exactly what the answer choices will be, the options will be. Now, how do we analyze the options? First of all, we read all the options before choosing the correct answer. And as I pointed out, even if the answer that you have decided is correct, based on your knowledge and your rationale, and you're seeing the connections between what the question is asking and what the answer is, what your option is, read them all, because an option can contain correct information, but it might have no relation to the STEM. Remember the one about the person who had the stroke? All of those options, no, the distractors, I should say, The three distractors pertained to characteristics that a person would have if they had a stroke, but only the right answer pertained to what the question was asking. Okay, another strategy to help you analyze a test item: do not add information to an option. Relate the option to what is being asked in the STEM. This is very important. This is how we talk ourselves through, how we do some critical thinking to help us come to the answer. Just like I said, if the option doesn't pertain to what they're asking in the STEM, then it's a distractor. And again, that question on the stroke patient fits that category. And then another option, another way to analyze the options is that we need to refer back to the keywords and important points of the STEM. So your answer choice, the right answer, should refer and relate to the keywords and the important things in the STEM. And as I said, if an option can contain correct information, but it might have no relation to the STEM. So you've got to keep going back and forth between your options and the STEM to verify that it's right or it's not right. It's just a distractor. Okay, this has been rather brief. There are books out there that can go into much more depth, but this is just kind of a quick overview to help you at the moment. And remember that good test-taking skills leads to passing NCLEX RN exams, including the big one, the one you get after you graduate. And good test-taking skills will lead to you becoming the RN. And that's been your plan. That's your goal. The end. Oh no. It's just the beginning. Nursing school is a pop quiz. Your professional life is the final exam. So I've enjoyed talking to you. I will be seeing you around on campus this semester. I wish you the best in your study, the best in your critical thinking skills, which will lead to your good test-taking skills. And I wish you a very good day.